Hello and Assalamu alaikum. After scan diagnostics say this is the CBCT of the patient that you had requested. The area of interest is the lower right 8 and the lower left 8 and their proximity to the inferior alveolar nerve. On the panoramic view, you can see that the inferior alveolar nerve is very closely associated with both the right and the left. So this is the right and this is the left. So here you can see that the inferior alveolar nerve is very close to the apex on the right hand side and on the left hand side. We take you to the transaxial view, which is basically the proximal view, and we're going to zoom in. There we go. So the highlighted portion is the inferior alveolar nerve, but as we move from the mesial aspect, you can very clearly see this is the mesial root of the distal root of the 7. As we move distally, you can see that this is the wisdom tooth which has started, and this is the mesial root of the wisdom. The mesial root of the wisdom is very closely associated with the inferior alveolar nerve. So here you can very clearly see that the inferior alveolar nerve and the apex of the lower right wisdom tooth are very closely associated. There's absolutely no gap. It's not compressing the nerve canal at the moment, but at the same time you can see that movement of the inferior alveolar nerve of the wisdom tooth will hamper the the inferior alveolar. So this is the distal aspect, and this is the mesial canal, the mesial root. So this is what the wisdom tooth on the lower right hand side looks like. Taking you to the lower left hand side, which is right here. So this is the mesial aspect of the lower right. We can see that there is very slight distance between the apex of the mesial root and the inferior alveolar nerve. As we move distally, this is the distal root, and on the distal root, you can see that it is very closely associated. It's even compressing. So when we remove the nerve highlighting, you can see that the inferior alveolar nerve is right here, and the canal is being compressed by the apex of the wisdom tooth, distal root of the wisdom tooth on the lower left hand side. So both in these areas, you can see that the inferior alveolar nerve is being compressed by the lower left wisdom tooth. Now, when we move to the axial view, which is the top to bottom view, here you can also appreciate that both the wisdom teeth are very closely associated. If we go, this is the crown portion of the wisdom teeth, and as we are moving inferiorly towards the apex, you can see that the inferior alveolar canal comes in very close association. We're going to remove the highlight, and this is the canal, and here you can see that the distal portion of both the roots, so the right hand side and the left hand side, compresses the inferior alveolar nerve, and this is something to be kept in mind when extracting both these teeth. So if you have any further questions, please feel free to reach to our team. Thank you very much.